Alright guys, welcome back to Underground Science, and in this video we'll be looking at the first stage of our cardiac cycle, which is ventricular diastole and atrial systole. Alright, but I didn't write that down, but we'll see that. Alright, so let's go and get started. So we have a sketch here of the heart, right? Hopefully I didn't draw it too bad. Hopefully we can actually get the concept down, right? So what happens is we'll take a look at both sides of our heart. But when we talk about the A, C, and V wave in our future videos, right, we'll actually look at, in particular, the left atrium. Okay, so let's go and get started. So the reason why it's called ventricular diastole phase is because our ventricles are relaxing and filling with blood at this moment. So if you guys recall, right, deoxygenated blood is coming from the superior vena cava of our heart, right, so this is our superior vena cava, and also deoxygenated blood is coming through our inferior vena cava of the heart. And the inferior vena cava right here dumps into our right atrium. All right, and we also have our coronary sinus that actually dumps into our right atrium also. All right, so our coronary sinus takes the deoxygenated blood from our heart muscles and dumps it into our right atrium. Okay, so all this deoxygenated blood, so I'll represent as blue, is getting dumped in to our right atrium. All right, now if we quickly switch over to the right side or the left side of the heart, right, so we just did the right side. If we quickly switch over to the left side of the heart, one second, let me just outline this a little better. All right, so if we quickly switch over to the left side of the heart, we don't have deoxygenated blood coming there, we have oxygenated blood through our, or we have oxygenated blood coming through our pulmonary veins. All right, so these are our pulmonary veins. Remember that from our previous videos in our cardiovascular playlist, cardiovascular system playlist. All right, so I'll draw oxygenated blood as red. So oxygenated blood, right, is coming in through our pulmonary veins. So our pulmonary veins over here on the right side and left side, but this actually goes through the back and empties in into our left atrium. And then our left pulmonary veins are also coming, right, and these are all coming from the lungs with fresh oxygenated blood. And right here, as we can see, our valves are open, right? And these are our papillary muscles, and these are chordae tendineae, right, that latch onto the valves and actually help it shut and close, or shut and open, right? Close and open. And so oxygenated blood is coming through here. And actually what happens is that without the atria contracting, about 75 to 80% of the blood actually goes into the ventricles by itself. So here we'll see that 75 to 80% of the blood, 75 to 80% of the blood, let's go and write that down here too, right? Just a little smaller, so I just drew a little bit more above to balance it out. 75 to 80% of the blood will actually passively flow down into the ventricles without the atria contracting. Then what's going to happen? So right now, the ventricles are almost at zero pressure. All right, so at this moment, ventricular diastole, they haven't contracted yet. So we're actually going to be around like a pressure of 0. Okay, so let's say we're at a pressure of 0 millimeters of mercury in both our right ventricle and left ventricle. All right, and what's going to happen now is that during the end, right? During the end, our atria, during the end of ventricular diastole, our atria is actually going to contract. Okay, so both our atria are going to contract, squeezing the rest of the blood into the ventricle. So the rest of about 25, or the rest of the 20 to 25% of the blood is going to get filled up via the atrial contraction. So the rest of the 20 to 25% of the blood will get filled up, all right, after the atria contract. So 20 to 25% of the blood. Now, once the atria contract, right, ventricular diastole is finished. Okay, and the reason why the atria can, or the reason why the blood actually flows down from the atria to the ventricles when the atria contract is, remember, because the blood wants to move from high to low pressure, right? And when the atria contract, we have higher pressure in the atria than in the ventricles, because the ventricles are just chilling right now, right? They're almost at zero pressure. So they're just trying to fill up, ready to squeeze the crap out of the blood, okay, into the systemic and pulmonary circulation. All right, so actually, you know what, let's go and write this down. So this pressure is for the ventricles during ventricular diastole. All right, And so if we take the left atrium in particular, right, we'll just take the left atrium for example here. When we're talking about the AC and V waves, when the left atrium contracts, right, and also the right atrium contracts too, but we're just talking about the left atrium here. When it contracts, we see a rise in pressure, and that rise in pressure is called the A wave. All right, so if we drew something right here, we would see a rise in pressure like that. All right, and so this would be called the A wave, and soon we'll see, especially in the isovolumetric contraction, right, of the ventricles, we'll see that we experience a C wave in our left atrium. All right, but for now, this is ventricular diastole. All right, and we'll look at the next phase, isovolumetric contraction, in the next video. All right, so I hope this video made sense to you guys, and I hope to see you guys in my next video. In my future videos, we'll talk about more cool topics about biochem, physics, and chem. Don't forget to hit that notification bell, like, and subscribe. See you guys later, and stay safe.